Welcome to the Friday edition of the MD Edge Daily News. I'm your host, Nick Andrews.
And I'm MD Edge editor Terry Rudd. Today, there's a new consensus statement on managing hyperglycemia in patients with type 2 diabetes.
Also today, the prescription opioid epidemic hits hard for migraine patients.
And later, mailing out fecal tests may improve screening rates for colorectal cancer.
But we begin today with a question. Should primary care physicians take over the treatment of chronic hepatitis C virus? Well, Dr. Michael Chris thinks that the answer is yes. Dr. Chris is a gastroenterologist at the University of Colorado. He spoke at a conference of internal medicine sponsored by the University of Colorado. Dr. Chris says that direct-acting antiviral therapy for chronic hepatitis C virus infection has progressed to the point that it is indeed time for primary care physicians to take on the treatment of all affected patients who do not have advanced fibrosis or other complex forms of the disease. He says that any patient with chronic HCV with stage 2 fibrosis or less should be treated by their primary care provider. Treatment of chronic HCV now entails just 8 to 12 weeks of DAA therapy. The cure rate is greater than 95%, and there are almost no side effects. Also, the costs have come down due to increased competition. Currently, guidelines from the American Association for the Study of Liver Disease and Infectious Diseases Society of America state that the non-proprietary biomarker assays are equivalent to transient elastography for staging fibrosis. Dr. Chris says that these guidelines are outstanding, and they are an extremely user-friendly resource for primary care physicians who are interested in taking on the treatment of chronic HCV. Recent studies have shown that the benefits of achieving a sustained virologic response include a clinically meaningful regression of advanced fibrosis at 1 year after treatment in roughly half of patients, and a reduced risk of developing hepatocellular carcinoma. The hottest controversy in hepatology has been whether or not to place HCV-positive donor organs in HCV-negative recipients. Dr. Chris says that this is intentionally giving hepatitis C to the recipient, knowing that he or she can be cured. He predicts that this will become standard of care within the next year or two.
Patient-centered decision-making, along with improved diet and exercise, constitute the foundation of all glycemic management. That's according to a draft consensus report on the management of hyperglycemia in patients with type 2 diabetes. The report's a project of the American Diabetes Association and the European Association for the Study of Diabetes. It's now under review and will be presented in final form at the EASD annual meeting this October. Dr. John Buse is co-chair of the Consensus Statement Writing Group. He says the current draft calls generally for the initial use of metformin. That's followed by the addition of anti-hyperglycemic medications based on patient comorbidities and concerns, as physicians and researchers await answers to the many questions that remain. Dr. Deborah Wexler of Massachusetts General Hospital in Boston is a member of the statement's writing group. She says the first step is to assess key patient characteristics. Those characteristics can include comorbidities, clinical characteristics, issues such as motivation and depression, and cultural and socioeconomic context. Dr. Wexler adds that the presence of cardiovascular disease is a compelling indication for the selection of certain glucose-lowering drugs. And the draft consensus recommendation differentiates between type 2 diabetes patients in whom atherosclerotic cardiovascular disease predominates and those in whom heart failure predominates. You can read more about the current draft report by clicking the link in the podcast description.
One in-depth retrospective observational study compared outcomes of opioid use in over 100 chronic migraine patients with outcomes from 63 other patients who have less episodic migraine. In the previous 12 months, over half of the chronic patients filled one or more prescriptions, which was more than 15 percentage points higher than patients with episodic migraines. Most notably, more than one-third of patients in the chronic migraine filled 3 or more opioid prescriptions, within that 12-month interval. 16% of patients in the episodic group filled 3 or more in the same period of time. In another study, researchers analyzed nearly 4,000 migraine patients who are currently using acute oral prescriptions. In another study, researchers analyzed nearly 4,000 migraine patients who are currently using acute oral prescriptions in the Migraine in America Symptoms and Treatment Study, also known as the MAST study. The MAST study is an internet-based epidemiologic survey of a national representative sample of patients with the disorder. At the top of the list, the most frequently used oral prescription acute headache medications were oral triptans. These were used by 46% of participants. This was followed by prescription NSAIDs, which were taken by 36%, and oral prescription opioids, which were used by just over 1/3 of participants. In addition, oral prescription barbiturates were used for acute treatment of migraine by over 11% of the MAST participants. These data were presented by Dr. Richard Lipton, who is Vice Chair of the Department of Neurology at Albert Einstein College of Medicine and Director of the Montefiore Headache Center in New York. Dr. Lipton says that there are a lot of opportunities to use new and emerging tools to improve the lives of patients.
And finally today, mailing fecal immunochemical tests to patients who are overdue for screening improved the rate of colorectal cancer screening in community health centers. That's according to a recent randomized trial published in JAMA Internal Medicine. The study included 26 qualified health center clinics that serve low-income populations in Oregon and California. The investigators identified more than 40,000 adults overdue for colorectal cancer screening. The core of the intervention was a set of electronic health record embedded tools that identified adults due for screening. That allowed the clinic staff to generate letters and mailing labels for a series of 3 mailings. The first mailing was an introductory letter. The second was a fit kit packet that included wordless instructions. And the third was a reminder letter. Outreach by mail led to an increase of more than 3 percentage points in completion of the fecal tests. 14% for the kit is in the mail clinics versus 10% for those that didn't take the postal route. Although the difference was statistically significant, the investigators said the improvement was less than expected. A pilot study had showed that the strategy of mailing fecal tests boosted completion rates by 38%. Somewhat larger effects were seen in an analysis that accounted for delays in the implementation of the program. In that analysis, the completion rates were about 18% for the intervention clinics and less than 13% for the usual care clinics. Dr. Gloria Coronado is a researcher with Kaiser Permanente Center for Health Research in Portland, Oregon. She says the project demonstrates that mailed fit outreach programs can have a clinical impact when they're integrated into clinical workflows. And that's the MD Edge Daily News for Friday, August 24th. The MD Edge Daily News is now on Spotify. You can also subscribe on Amazon Alexa, Google Podcasts, and Apple Podcasts. For MD Edge, I'm Terry Rudd.
And I'm Nick Andrews. The MD Edge CardioCast is all new today. You can subscribe to the CardioCast wherever you get your podcasts. And be sure to check in with MD Edge again next week when we will be covering the upcoming European Society of Cardiology meeting from Germany. Check in with MD Edge all week long for the latest.